Unraveling the mystery of hereditary pancreatitis, a genetic revolution. In a groundbreaking development, a new genetic test from Mayo Clinic is revolutionizing the way we approach hereditary pancreatitis. This complex condition, often shrouded in mystery, can now be diagnosed and managed with greater precision and clarity. Pancreatitis, an inflammation of the pancreas, is a challenging disease to tackle. It can present acutely, recur, or become chronic, leaving clinicians and patients alike searching for answers. The symptoms, ranging from abdominal pain and fever to rapid pulse and weight loss, can be debilitating and lead to severe complications such as breathing difficulties, infections, and even pancreatic cancer. The statistics are eye-opening. In 2021 alone, nearly 3 million new cases of pancreatitis were diagnosed worldwide, with an estimated 5.9 million people living with the disease. This highlights the urgent need for innovative diagnostic tools and management strategies. Pancreatitis is a complex beast with many potential causes, explains Motaz Ashkar, MBBS, a gastroenterologist at Mayo Clinic's Pancreatic Clinic. When we can't pinpoint the cause, genetic testing becomes our best bet. Enter Mayo Clinic's new Hereditary Pancreatitis Gene Panel, a collaborative effort between scientists, clinicians, and genetic counselors. This panel, available through Mayo Clinic Laboratories, is a prime example of patient-driven innovation. The previous test, covering only 4 genes, has now been expanded to 9, incorporating the latest research and clinical insights. Unlike some commercial panels that cast a wide net, Mayo's test is intentionally focused, targeting genes with strong associations to pancreatitis and pancreatic cancer risk. There's a misconception that bigger is better in genetic testing, says Linda Hasadzri, MD, PhD, a clinical molecular geneticist at Mayo Clinic. Including genes with weak or unproven associations can lead to confusing or meaningless results for patients. The panel includes well-established genes like PRSS1, SPINK1, CFTR, and CTRC, as well as newer additions such as CPA1, CASR, and CLDN2, which are increasingly recognized for their role in pancreatitis and cancer risk. Built on whole exome sequencing, the test provides a comprehensive analysis of an individual's DNA blueprint, allowing for a deep dive into the coding regions of the genome. However, this approach comes with challenges, particularly with tricky genes like PRSS1. PRSS1 is the most common cause of hereditary pancreatitis worldwide, especially in children. But it's notoriously difficult to test accurately, Dr. Hasadzri notes. We've seen a lot of false positives and negatives from other labs. To address this, Mayo developed a custom assay with multiple supplemental methods to confirm results and avoid misdiagnosis. The lab also implemented reflex testing capabilities, meaning if a result is inconclusive, additional testing can be automatically performed without the need for a new sample or additional billing. The clinical impact of this test is profound. A positive result can explain a patient's symptoms, guide treatment decisions, and inform cancer surveillance strategies. For instance, if a patient has a PRSS1 pathogenic mutation, their risk of pancreatic cancer is elevated, allowing for earlier and more frequent monitoring. The test also opens doors for family testing. If a patient tests positive, their relatives, even those without symptoms, can be screened, enabling early intervention and lifestyle changes to prevent disease progression. Even a negative result has value, ruling out hereditary causes and reducing unnecessary testing and anxiety, Dr. Hasadzri adds. Looking ahead, the team is exploring the potential of creating a polygenic risk score test for pancreatitis, which would assess multiple risk factors to calculate an individual's disease risk. This new genetic test is a game changer, offering hope and clarity to those affected by hereditary pancreatitis. It's a testament to the power of patient-centric innovation and the dedication of Mayo Clinic's experts. But here's where it gets controversial. Should we be concerned about the potential for overdiagnosis or unnecessary interventions based on genetic testing results? And this is the part most people miss. How do we ensure that genetic testing remains accessible and affordable for all who need it? What are your thoughts on the role of genetic testing in healthcare? Share your comments below, and let's spark a conversation.